కామ్ని ఇనాగ్రేషన్ చేయటం జరిగింది. ప్రత్యేకించి ఉదయ్ ఓమ్ని హాస్పిటల్ వారు టెక్నాలజీ పరంగా ముందుకు పోయి ప్రధానంగా పేషెంట్స్కి తక్కువ పెయిన్తోని రిలీఫ్ ఇచ్చే మరి టెక్నాలజీని ఉపయోగించుకోవాలని ఆలోచన చేయడం అనేది గొప్ప. మరి వారికి శుభాకాంక్షలు తెలియజేస్తూ రేపు టెక్నాలజీకి సంబంధించి రాబోయే కాలంలో పేషెంట్స్కి అతి తక్కువ ధరలో వారి ట్రీట్మెంట్ కానీ వారి ఆపరేషన్స్ కానీ వారికి సంబంధించి వారి కుటుంబ సభ్యులకు సంబంధించిన సమస్యలను పరిష్కారం చేసేందుకు ఉపయోగపడాలని మా ఆలోచన.
This is Dr. Udai Prakash at Udai Omni Hospital. I'm an orthopaedic surgeon specializing in joint replacement surgery. And today, we are extremely proud to have this machine with us, which is a robotic arm that helps me do a knee replacement even better. And I have been doing knee replacements for 20 years. And I'm very satisfied with my conventionally done approach. And most of my patients are extremely satisfied with the conventional non-robotic surgery. However, I was very attracted by this machine because what this offers me is even more precision than what I normally do. And by this I mean I can restore the alignment of that particular patient to their native alignment. That means I can put a knee so precisely that the patient feels that it's his own natural knee. This is what the robot allows me to do. It helps me plan the operation before the operation. We take a CT scan, we feed the data into the robot, and we program the robot to execute the plan to my liking, to the very last degree and to the very last millimeter. So we hope that this robot will give our patients a fantastic life in the future and an implant that will hopefully last all their life. And the other exciting thing about robotics is that it'll help us do other kinds of orthopedic surgery like a hip replacement, like a partial knee replacement, spine surgery, correction of deformities, trauma surgery, all very, very precisely. So the outcomes of surgery will improve in the future. So this is a very exciting development. And I'm proud to say that what we have here is something that was developed in India. It is an indigenous product, and the software is designed by Indians from the IIT, and I'm so proud of them for coming up with something that is competing with the best in the world.